Good morning, guys. So my today's topic is biofeedback. Now we can see the introduction of biofeedback. Biofeedback is a mind-body technique that enable individual to learn how to control body processes that are normally involuntary, such as heart rate, muscle tension, blood pressure, and skin temperature. This is achieved using electronic and electromechanical instruments that provide information, or we can say that the feedback about physiological activities. Now we can see the types of biofeedbacks. There are several types of biofeedback which we can use for the different techniques. The first one is the electromyography biofeedback. In electromyography feedback, we can measure the muscle electrical activity, the activity of the muscle, the contraction and relaxation of the muscle. We can diagnose that or observe that. Purpose to use of EMG is to help patient learn to control muscle tension. For the controlling of muscle tension, we can use the EMG biofeedback used for muscle retraining after injuries, after surgeries, tension headaches, chronic pain, example back pain, neck pain, and the post-stroke rehabilitation means after the stroke when the patient get recovered a little bit from the stroke, they are in that phase of rehabilitation. We can use the EMG biofeedback. Now we can see the example of it. A person with back pain learns to relax specific muscle while watching EMG feedback on the screen. Means the person will see directly on the screen how much recovery of that muscle is there. So by seeing that recovery, the patient get the confidence to gain more and more biofeedback, and they will do more exercises. Now we can see the second type of biofeedback, which is thermal or temperature biofeedback. This is mainly used for skin temperature, measurement of temperature. Usually from finger to feet, we can use it to measure the temperature of the person's body. The purpose of the thermal biofeedback is to indicate blood flow or which will link it to stress. Means if the person has a high blood flow, then the temperature of the body of that person will rise. So for measuring that temperature, we can use the thermal biofeedback used for migraine and tension headache, anxiety disorder, and the Reynolds disease, or we can say a circulatory disorder. In this, we can use the thermal biofeedback. Now we can see the example of it. A person can learn to increase finger temperature by relaxing and improving in blood circulation. So this is the example of thermal biofeedback. Now the third biofeedback is the biofeedback, which will also includes in EEG. So the measurement of neurofeedback is the brain wave activities, the activities of in brain. In the EEG, the brain activity will be measured. The sensors, or we can say the neurotransmitter will be activated, or we can say that measured in the EEG machine. The purpose of using neurofeedback is to help the modify brainwave pattern, or it is also used for anxiety and depression and the epilepsy patient or the patient who has sleep or disorder. For that type of people, we can use the neurofeedback. The example of neurofeedback is a child with ADHD may use neurofeedback to increase focus and reduce impulsivity by learning to increase beta waves and decrease theta waves. So this is the example of neurobiofeedback. The fourth one is the heart rate variability biofeedback. Means the heart rate biofeedback. We can say that to measure what should we measure in this biofeedback is the variation in the time interval between heartbeat. So there are specific rhythm of the heartbeat, and there are specific time for one rhythm. So in between two rhythms, the interval in the between of two rhythms, we can measure that by using the heart rate variability biofeedback. For the purpose of this using is to improve autonomic nervous system balance and reliance to stress. So it is used to anxiety person, depression, post-traumatic disorder, and the asthma and other heart-lung conditions. In these conditions, we can use the heart rate variability feedback. Now we can see the examples. A patient practice breathing technique in rhythm with visual clues to improve heart coherence. Means by seeing the rhythm of the breathing, person can do the exercise. The fifth one is galvanic skin response biofeedback, which is measuring the skin conductance, or we can say the sweat gland activities. Means if the person get higher sweat, then the machine will indicate that. If the person get lower sweat, then also machine will detect that. So for purpose of using this is reflect emotional arousal or stress level. Means if the person has higher stress then the sweat is more. So by using this we can ultimately come to know that the person is in under stress. So it's used for stress and anxiety management and lie detection technique. So basically this biofeedback is used by the cops, or we can say the policeman, for detection of lying. If the person will lie, then he or she will come under the stress, and when the person will come under the stress, the sweat are coming more outside from the skin. So the example of this, a person can learn to reduce stress by observing skin conductance response and practicing calming techniques. So this is the example of how the person will subside the stress of his or her by seeing the skin conductor response on the screen. Now we can see the another biofeedback, sixth biofeedback, which is respiratory biofeedback. This is measured in respiratory biofeedback. We can measure the breath rate and the pattern of the breathing of the person. So the purpose of using is to improve breath control and reduce stress. It is used for the asthma, panic attack, and COPD patients. This is the condition in which we can use the respiratory biofeedback. The example of the this feedback is a patient learn to take slow, deep breath and watching a graph by their breath rate. Means person will watch the graph on the screen of their breaths, how many times he will take inhalation or exhalation. By seeing that, person can perform breathing technique. The seventh biofeedback is the electrodermal activity biofeedback, which is closely related to galvanic skin response, as I say in previous. So this is measuring the electrical conduction of the skin and influence the square influenced by sweat glands activity. So these are the this biofeedback is like commonly same as the galvanic skin response. It is used to for in physiological research to detect emotional response. As I say in the galvanic skin response, this is, biofeedback is also same used as the same activities but in different manner. It will also apply in lie detector, stress therapy, emotional regulation training. This is also used for that. Now, the eighth biofeedback is the blood pressure biofeedback, which is measured in the real-time systolic and diastolic blood pressure. It is used for to measure the systolic blood pressure of the patient and the diastolic blood pressure of the patient. The purpose of using that helps people manage hypertension through relaxation and breathing control. It is used for high blood pressure like the hypertension condition and the cardiovascular risk reduction. This is the condition in which the blood pressure biofeedback will be used. The example of this biofeedback is patient lowers their blood pressure using slow breathing and visualization technique. By seeing the blood pressure on the screen, the patient can calm down and the blood pressure will automatically fall. So now we can see the another type of biofeedback, which is the ninth one, voice biofeedback, or we can say the voice therapy, which is measured the pitch, loudness, and the tone of the voice of the patient. Using the purpose of using this biofeedback is to help the vocal rehabilitation. By using the vocal or the voice of the therapist, we can rehab the patient. It is used for the patient who has speech disorder or the vocal strain in teachers, singers, or public speakers. The speakers who is speaking like in the bunch of in front of bunch of people, or they are giving speech to the patient in the church or anywhere. That type of person, we can use this biofeedback. Now we can see the example of this biofeedback. A singer sees a visual graph and of their vocal frequency to correct the strain or the pitch. So you can see that some of the singer has to manage their voice according to the rhythm of the sound. So by seeing the graph or by seeing the voice pitch graph on the screen, singer can assume that how to manage the vocal frequency of their voice. Now you can see the another type of biofeedback, which is postural biofeedback. It is measured for the body element, movement pattern, and muscle tension. The purpose of using is the correct posture using real-time visual or audio feedback. It is used for the patient who has back pain, neck pain, and the ergonomic training and the scoliosis management. The postural feedback means if the patient has any type of postural disability disorder, for that type of person we can use this biofeedback. An example of it is a sensor on the spine alert when the user's couch are promoting the posture correction. This is the example of the postural biofeedback. Now, the another biofeedback is the pelvic floor biofeedback, which is measure the muscle tension and the activities in pelvic muscle. The purpose of using this biofeedback is to help to retain the pelvic muscle for urinary or bowel control. The person who is not able to lift or use the muscles in the from the pelvic, that type of person we can use this biofeedback. It is mainly used for the urinary incontinence, pelvic pain, or childbirth recovery. For that type of person, we can use this biofeedback. The example of this biofeedback, or we can see uh, device which we use in this biofeedback is EMG sensor or pressure sensitive probes inside the vaginal and rectal area of the patient. Now we can see the another type of biofeedback, which is functional magnetic resonance imaging, fMRI biofeedback, which is measure blood flow and the activity on specific brain area. So the purpose of using this to train the patient, train the people to control the brain activity and associate with the emotion or pain. It is used for chronic pain, depression, and the brain injury recovery. For that type of person, we can use this biofeedback. Now, the another type of biofeedback is near infrared spectroscopy biofeedback, which will mainly measure the brain oxygenation level. Or the purpose of using this is alternative to EEG for brain-based biofeedback, which is used for cognitive training, attention and learning disorder, and the stroke rehabilitation, as the same as the EEG one, as I see in the previous. The 14th biofeedback is the skin potential biofeedback. It will measure the electrical potential difference on the skin surface, which is mainly uses for the similar to GSR, as I say in the previous, but the focus is on voltage rather than conductance. In GSR, the skin conductance mainly focused, but in the skin potential, the voltage and the focus of this biofeedback is on the voltage. It is used for the mental state monitoring and the psychophysiological researches. The last biofeedback is the motion-based biofeedback, which is measured the limb or joint movement using accelerometers and gyroscopes. The, it is used for gait training, sport performance, balance rehab. The person who has stroke or Parkinson, for that balance training is much needed. So for that type of person, this biofeedback we can use. So now we can see the example of this biofeedback. Wearable sensors provides real-time feedback during walking therapy. Thank you for thank you for your time. So this is the biofeedback from my side. I am the Sejulia Hitchansu from second year B Physiotherapy. Thank you.